All right. Now, if you give 1 minute to read text A, if you give 1 minute for B, another minute for C, another minute for D, then you have 4 minutes. It takes 4 minutes for you to go through the four text boxes that they have given in the reading subtest. Okay. So if you deduct, so 4 minutes, right? So if you deduct from 15 minutes, if you deduct four, that becomes how much? 11 minutes. So basically, you have to attempt 20 questions in 11 minutes. So one question is going to be equal to 11 by. That's like in a minute, you have to attempt two questions, right? You have to be very fast. That is the uh, hallmark of A part of reading. Means ekdam fast on, you have to be super fast with A part. So after A part's over, they give you B and C collectively. B or C collectively tinarle dinchan, right? So A part 15 minutes, B and C parts it takes 45 minutes. So let us talk more about B and C. We are going to do it. Wait. So B part has 6 questions. 1 plus 1 plus 1 plus 1 plus 1 plus 1. None of the questions are related to each other, and it is going to be multiple choice questions. Then we have C. C has 8 plus 8 questions. So C1, 8 questions, C2, 8 questions, and it's also MCQ. It will have 4 choices. The choices. And B part ko, you have 3 choices. That's the difference. In listening, what happens is B has 3 choices and C also has three choices. But here it's different. B will have 3 choices, similar to that of the listening, and C will have 4 choices. Okay. So let us start getting acquainted. Let us start. So see this. So this is text A. I'll give you a minute. Just have a read. I'll tell you how to do it. Just read, and I'll tell you how to do it. Going to discuss and everything. Yes, it's 9 seconds. Just do a random reading. All right, it's a minute. So Gornezikio, note down whatever I'm saying. The part A mostly has definition of any given topic. So this one's talking about the whole text is about necrotizing fasciitis, isn't it? Necrotizing fasciitis ko कुरा गर्दैछ. The whole text will be necrotizing fasciitis. Yeah, definition. The A part, definition. Most of the time, definition. So when you read this, yeah, you pour that. What do you see? Necrotizing fasciitis is a severe, rare, potential lethal soft tissue infection. They're talking about what are they talking about? They're giving definition, isn't it? अब आयो part तपाईँको second part of this part A, we have classification. Sometimes they give you definition with classification, sometimes definition with issues, definitions with complications, definition with tests. So your variation ma airako huncha, but remember that A part mostly will have definition of certain things. Very rarely they will change it. You can imagine a long essay being cut into 4 equal pieces where the A part usually will have introduction. So introduction just the right? So another important things about reading ma अर्को important कुराहरु के हुन्छ जस्तै numbers have to be, you have to be very aware of these numbers. Yeah, so numbers, semicolons, use these parentheses, brackets एकदम important, so you have to always keep it underlined. किन underline गरेर राख्ने यो कुराहरु? आउने chances धेरै हुन्छ. You will see while practicing later that they always will ask you questions from parentheses. That's when parentheses भनेको bracket, number. So what I suggest you from day one itself is that you give signs. Like for example, for number, you put heart. Yeah. For brackets, maybe you can put asterisk or star, asterisk, asterisk. So what happens is that when you start reading, you start underlining a lot of things. And when you start underlining a lot of things in the exam, while you look for the answer, while you hunt for the answer, you think all of them are important. Antedipela, you get confused, like, oh, I have underlined this, I have underlined that, I have underlined literally everything. So how do I find the answer? So I've told this earlier, I'm telling it now, that number they give you like 2 to 3 questions related to number. So why not to put heart? So if you see that there is a particular question that is related to number, just start hunting for heart. Okay, and anything that you see, anything abnormal, like anything abnormal, or what I mean is like with a semicolon or a dash, you should always underline. Another important thing is that whenever you see or, esto halko or, you should give another sign for that. For example, let's give it a triangle, for example. How many chances or? So in a question, if they have or, हामीले or line scan गर्दै हिँडेपछि we can find out. And just check a little bit, type pathogen, site of infection, la body or part of the comorbid conditions or the So 1 minute I'm giving you now, I already gave you now a while ago. For example, कुनै कुराको already heading छ भने खासै just don't spend more than 10 to 15 seconds. You can see, okay, this is a definition and this is a classification, and then we have few brackets, we have few numbers, percentage, and move forward. Because the less time that you give for the scanning and skimming things, the more time you get for attempting the questions, right? So heading bhakoharu huncha ni, whenever there is a heading given, like classification diएको छ, definition दिएको छ, it's an easy text. You do not need to think too much यसको बारेमा, हैन? अब आयो पालो B को. Let's go to B. Now this also has a heading. I'll give you a minute, scan it. Sarra पढ्नु त. Okay, so यहाँ पनि check, there's one more, a little paragraph, the type 4 as well. Yeah, so check. यसमा पनि अब we do not need to waste our time. Antibiotic भनिदिरहेको छ. I mean, A is not talking about antibiotic. A मा त कसैले पनि antibiotic को कुरै गरेको छैन. Right? What is the difference between text A and text B? Text B particularly talks about antibiotic, different types of necrotizing fasciitis. हैन र? औषधि नै औषधि छ. And you must be noticing there are a few numbers. Again, put heart on top of them, like 5 days, heart लगाइदिने, 4 to 6 weeks, heart लगाइदिने, हैन? And if you see any ors, you should also kind of underline or put maybe star, triangle, whatever. You can make your own system. It doesn't matter. But that's what I do. So again, also we have a lot of numbers and we have these brackets. If you have brackets, always I've told you like asterisk halde is like a star banai it depends on you. Very dash China. Keep this like type 1, type 2, type 3, type 4. Yeah. So B is all about antibiotics. A is all about definition and classification. B is about antibiotics. C यस्तो खालकोमा headache हुन्छ. You should give a little bit more time because you need to categorize this by yourself. I'll give you a minute. Can you find a name for this? Sarra पढ्नु यसलाई अनि आफै एउटा heading दिन खोज्नु त्यसलाई. Because A and B already has a heading, but C doesn't have a heading. So what heading would you like to give it? I'll give you a minute. Check. We're going to have a discussion later. So how would you name this? Care management, just the paragraphs. Look at this. Supportive care in ICU is critical to NF survival. This involves fluid resuscitation, cardiac monitoring, aggressive wound care. के भयो यो सबै care management भन्दिम. So management paragraph भन्दिम. यसमा important, what are the important points? You need to underline these dashes. You see the brackets, parentheses. Anything weird like split thickness. It's not weird, obviously, but any dash, colon, semicolon, I know. If you notice, then you can just underline and put asterisk or star or triangle or square, whatever you please to do. Now look at the D. I'll give you a minute, check it out. It already has a heading, see? Advice to give the patient before discharge. Remind the diabetic patient too. Before discharge, the patient got जान लागो, so the patient is going home, isn't it? So future paragraph भन्दै नि भयो, yeah? This is 7%. You should underline these numbers and put a heart there. If the question is related to number, we're just going to refer to the heart and find it quick. Yeah, just read it anyways. Just skim it. All right, so 1 minute already. So you must be noticing that A, B, C, and D, all these 4 texts are talking about the same topic. Every topic ko kura garदैछ, necrotizing fasciitis, but they're talking about the different aspects of the same topic. त्यसै topic को अलग-अलग aspect को कुरा गर्दैछ, हो कि हैन? So check. So यसै याद गर्दाखेरि, what is it? A is definition classification, B is all antibiotics, antibiotics, antibiotics. C is all about management. D is all about future, like discharge plans, right? Yeah, you agree? So so look at this. First few questions are going to be location-based questions, right? So tell me, look at the first question. First question, the drug treatment required. The drug treatment required, कहाँ होला यो? A मा छ कि B मा छ कि C मा छ कि D मा छ?
B.
Yeah, औषधि भन्ने बित्तिकै it's in B, right? So medication भन्ने बित्तिकै B. A doesn't talk about any medication. C doesn't talk about any medication. D doesn't talk about any medication. So there's only one that is talking about medication, but B, that's antibiotics, right? So medication and medications. Now, which parts of the body can be affected? कहाँ होला यो A, B, C, D मा? So you should learn how to deduct as well. D is all about future plans, discharge plans. C is all about, what is in the C? Management. Now, which body part can be affected? And B is all about medication. A matra baki bho. So it's most probably in A. Article number 3 ma. The various ways calories can be introduced. Where do you think it is? Everybody, Srijana, can also participate. Guess. अघि हामीले गरेको summary पढेको त्यसबाट the various ways calories can be introduced.
C, sir.
Yes, exactly. It's a management thing, yeah. Who to contact to help the patient after they leave hospital? Leave hospital. भनेपछि
D.
D. Yes. Discharge plan मा पर्यो हैन. What kind of dressing to use? Where do you think it is?
C.
Yes, it's management related. How long to give drugs भन्ने बित्तिकै कहाँ पुग्यो?
B. B.
Correct. What advice to give the patient regarding needle use? Advice भनेपछि
D.
yes. Future plan. Right? That's how it works. Okay. Now, after the location questions are over, now we need to find the location. We need to also find the exact words. Now, 8 number question लेके हुन्छ. Which two drugs can you use to treat the Clostridium species of pathogen? Drugs भन्ने बित्तिकै where do we go? A, B, C, D मा. Drugs भन्ने बित्तिकै कहाँ पुगिन्छ हामी? A, B, C, D. Which one?
B.
A होइन B. Drugs, all antibiotics भन्ने बित्तिकै everything is in B. Now, what are the keywords? Keywords, oh, remember the secret of reading is to not read. So if you invest a lot of time reading, you're going to fail. It's about finding things with tricks, with keywords. So two drugs, questionless duita drugs mangirako cha, that is related to Clostridium. So it's very easy. Duita ausadi Clostridium. Clostridium is the keyword because they are not going to give synonym of Clostridium. Clostridium goera bima. Wherever you find Clostridium, there you'll find the name of the medication. Go and start hunting for Clostridium. Or Clostridium sanga bhako duita medication like copy paste gardine. Did you find a hunt for Clostridium?
Yes. Clindamycin and good.
Sabai parne haina ni, you just have to start looking for Clostridium. There you go. Clostridium yaha cha tyoसँग भएको दुईटा medication. Yeah. Clindamycin and penicillin. That's what you copy here. Done. After that, we have okay, next one. Which common metabolic condition may occur with NF? NF सँग कुन चाहिँ common metabolic condition हुन सक्छ? So where do you think it is? The location?
A.
Yes, A. In A, we have to find a metabolic condition or disease condition. So खोज्नु त्यहाँ A मा गएर disease condition कुन छ? Metabolic condition. We do not look for apple or banana. We're looking for a metabolic condition. That's a disease condition. Yes, there's only one metabolic condition that's given. That's a diabetes mellitus, right? Move forward. Okay. Next one. What procedure can you use with a wound if the patient can't be operated on? Meaning, patient ma operation garna sakiyen bhane, patient la mathi operation garna sakiyen bhane, kun procedure use गर्ने? So where do you think it is? B is not possible because B is all talking about drugs. A is talking about definition and classification. A to B is out of equation. D is talking about the future. So there's only one text box that's left. That's C. Right? So what procedure can you use with a wound if the patient can be operated on? So basically, keyword ke is mahamro, operated, operation, surgery. So if you have to look for this keyword and hunt in C, and you'll find the answer. Procedure भनेपछि कुनै होला त्यहाँ हेर्नु. सर्जरीलाई हेर्नु. Operation को के synonym हुन सक्छ? Operation, surgery, procedure. So start looking for these keywords and scan. What's the answer? Vacuum assisted closure. Procedure सोधिरहेछ नि. So you must be noticing VAC भनेको dash पनि छ, and it also has brackets. So it says vacuum assisted closure was recently reported to be effective in patients whose cardiac status was too precarious to undergo a long surgical reconstruction operation. Operation आयो कि आएन? जुन पेशेन्टमा लामो समयसम्म अपरेसन गर्न सकिन्न त्यसमा त्यो पेशेन्टलाई यो प्रोसिजर युज गर्ने भनेर सोधिरहेछ. That's the answer. So you basically copy vacuum assisted closure, VAC, right? Number 12. What should the patient be told to use to clean an injection site? Injection site सफा गर्नलाई पेशेन्टलाई हामीले के भन्नुपर्छ? Now where do you think it is out of A, B, C, and D? It is in which text box? A, B, C, or D? So A is talking about definition classification. Is the question related to definition classification? Of course not. Is it related to antibiotics? Of course not. Is it related to care? No. No, it is related to care, but future care should be told. Matlab, something that you have to tell for the future. Where was that? D. Keyword injection site. Injection. So injection site सफा गर्नलाई के भन्नुपर्छ पेशेन्टलाई भनेर सोधिरहेको छ. So look at the injection site. So look for the keyword injection. Injection site like केले सफा गर्ने हो? Basically question त्यही हो. So don't start reading. Yes, alcohol pads. Don't start reading the whole thing. Just search for the word injection because they're not going to use synonym for injection. Right now, increase को augment गर्देला, increase को अरु केही भन्देला हैन, fast भन्देला. But I mean they cannot use synonym for injection or medical terms. Yeah. Okay. So after this we have injection site now. Here, number 13. Look at number 13. Which two drugs can be used if you can't use vancomycin? Vancomycin use गर्न सकेन भने कुन दुईटा drugs use गर्ने? Where do you reach with question number 13? Two drugs भनेपछि कहाँ गइन्छ? A, B, C, D मा. Where do you reach? What does it point towards?
B.
Obviously. So two drugs means they're asking for the name of two medications. Now what is the key word here? Vancomycin. Vancomycin ko sattama, ko ठाउँमा, what two drugs can we use? I know. So our keyword is vancomycin. You just start hunting for the keyword that is vancomycin and you'll have the name of the drugs. Search quick. यस्तो गाह्रो छ र यो खोज्नुलाई I mean it's that difficult to find vancomycin V खोज्दै हिँड्ने त नि यति टाइम लाग्नु नपर्ने हो
Daptomycin and linezolid.
Yeah, linezolid. Very slow. It's too slow. If you go the speed, then in the exam you're going to skip the questions. So फटाफट खोज्दै जाने vancomycin hunt गर्दै जाने vancomycin. That's a keyword because they're not going to use synonym for vancomycin. Vancomycin को synonym के हुन्छ हुँदैन नि. So what kind of infection should you use tetracycline for? Very easy. Keyword हो हाम्रो tetracycline. कस्तो खालको infection को लागि use गर्छ? Check. Look for tetracycline. कस्तो खालको infection मा, what kind of infection do we use? Tetracycline. So our keyword is tetracycline. Obviously, we know that all the medications have
Vibrio infection.
Yes, Vibrio infection. Yes. Then we are entering the fill in the blanks. The average proportion of patients who die as a result of contracting. Answer के मा छ? Number मा. र answer percentage मा छ. So where do you think is the answer? 15 number go. A मा percentage खोज्ने हो. Remember, we have to hunt for the heart. It's a percentage.
32.3%. 32.3.
Sorry, mortality. Sakyalo, game over. Right? Now look at this. 16. Patients who have eaten blah blah blah. You blank ma bhako kura patient le khako cha bhane Aeromonas hydrophilia le infected huna सक्छ. The patient who have eaten you blank ma bhako kura can be infected with Aeromonas hydrophilia. So, where do you think it is?
A.
Yes. Keyword के हो हाम्रो? Aeromonas. Look for the word Aeromonas hydrophilia.
Seafood.
You must be noticing the bracket मा छ है फेरि. It's in the bracket. Yeah? Okay. Okay, next question. Patients with type 2 infection usually present with infected. Type 2 or type 1, there are only two text boxes that talks about type 1 and type 2. Types are okay. So जो patient मा type 2 infection हुन्छ त्यो patient को कुन part infected हुन्छ? Where do you think it is?
A.
No. Check. Body part खोज्नु type 2 को. यस्तो easy छ type 2 खोज्ने हो.
Limbs.
Correct. अर्को ल यस्तो easy. Type 1 NF is also known as कहाँ होला?
A.
ल type 1 को synonym भन्दिनु.
Polymicrobial.
You must be noticing bracket but I question, yes? Okay, 19. The patient needs to be aware of the need to keep glycated hemoglobin levels lower than number मा छ. अर्को कुरा, where do you think it is? A, B, C, D. Patient future को कुरा गर्दैछ glycated hemoglobin lower than
D.
D मा. अब glycated hemoglobin खोज्नु answer पाइहाल्यो. Number मा छ answer.
7%.
Yes, because heart like खोजिहाल्ने फटाफट. Whole the 4 text boxes that we have, the only 2 places they have numbers in percentage. एउटा mortality सँग related. एउटा अर्को. I mean, दुईटै percentage, but one related to mortality, one related to glycated hemoglobin level. Now, the patient will need a course of you blah blah. यो blank मा भएको कुराको patients like course चाहिन्छ आफ्नो fitness level regain गर्नको लागि कहाँ where do you think it is D yes start hunting what does the patient need to regain the fitness level regain चाहिँ हाम्रो keyword हो या regain कै हाम्रो कुनै synonym keyword हो
Physical therapy.
correct यो हाम्रो end of the B what happens तपाईँको question sheet answer sheet they will take it away अब आउँछ B part yeah look at this there are two ways you do the B I personally like to read the statement the policy document tells us त्यसपछि I like to go to the text box and then I come back to option a lot of candidates they also read the statement they understand the options and then they go to the text box so why I suggest you do the other way the first one the first option because we are medical professionals and we have certain knowledge about certain things हामीले आफै judge गर्न खोज्छौं के and that is the point where you start making mistakes so B is like this and none of the questions will be related to each other you must A part ma all the 20 questions were linked to the 4 text boxes here it's quite different so just check let's see I'll give you 2 minutes do however you want and we're going to have a discussion about it there you go 2 minutes it's 2 minutes tell me
Answer B हो
होइन Anyone using EPMA can disregard their request for stop date. No. Nobody is disregarding. Disregarding matlab in nadinu. Just exactly. It's A. Stop dates aren't relevant in all circumstances. So whenever you want, you can manipulate as long as you write and note it down properly. Yeah. A वो answer इसको. So it says, if the prescriber knows how the course of IV should be, then the stop date can be filled. If not, then a review. I mean, थाहा भए पनि, थाहा नभए पनि. I mean, you can still manipulate. Check this. 2 minutes. All right, 2 minutes. के गर्छ? A, B, C, D. Oh, sorry, A, B, C. Out of A, B, C. A, B, and C. Which one?
B.
Correct. Check this. Super easy.
A.
Wrong. Not A.
A. C.
No. B, ni. Position electrode. Electrodes correctly. They're talking about how to put the electrodes, isn't it? In the whole thing.
Mm.
Check this. Answer? It's 2 minutes already. Answer curious. Which one?
A,
No. Where have they given that their treatment can be completed over a reduced period of time? No, it doesn't talk it. Where does it talk? Which sentence made it believe? The authors suggest that rather than attempting to change the character of these who are impatient, it may be wise to ascertain the patient's individual priorities, particularly as they relate to immediate gains. Barker ko gain, Barker ko faida. For example, while advising an impatient patient with diabetes, stressing improvement in visual acuity rather than avoidance of retinopathy may result in greater medication adherence rates. भनिरहेको छ कि भविष्यमा जुन रेटिनोपैथी हुन लागेको छ त्यसलाई अभोइड गर्न सकिन्छ इफ यु टेक मेडिकेसन भन्ने ठाउँमा इट इज बेटर टु से दैट you'll have a better vision now त्यो भनेपछि पेशेन्टले मोर लाइकली मेडिकेसनसँग एडहियर हुन्छ एडहियर भनेको compliant. Yeah. 5 check. Okay, 2 minutes. What do you think? Which one do you think is correct?
B.
Oh, good. You're an A or C wrong, sir. X-raying a patient unless pH reading exceeds pH, avoid गर्नुपर्छ रे मतलब 5.5 भन्दा माथि pH छ भने एक्सरे नगर्ने भन्दैछ तर यहाँ उल्टो भन्दैछ 5.5 भन्दा माथि छ भने गर्नु भन्दैछ राइट द्याट्स रङ अनि रिलायन्सको कुरै गरेको छैन कतै पनि भेरी वेल डन गुड चेक दिस
B.
B no how is it B the dosage of oxytocin is determined by the uterine response hmm? के हुन्छ answer त्यसो भए the amount of oxytocin given will depend on how the patient reacts A now we are entering C part this is a C1 that's phobia pills there's also a C2 there's going to be that's challenging medical thinking on placebo C1 and C2 both will have 8 and 8 questions out of the questions here you can check 1 2 3 4 5 6 7 and 8 yep so first of all the first task is to count the number of paragraph 1 2 3 4 5 6 out of there are 8 questions but 6 paragraph that means every paragraph usually has one question so there are 6 paragraphs 6 will have 6 questions that means 1 or 2 will have double or maybe 3 questions for one it's very rare that they ask 3 or almost impossible so duita bata they will ask double questions in that way it will become 8 yeah so the good news for reading part C is that all the questions are chronological. If the first question is asked from first paragraph, the second going to be from the second, the third one cannot be from one. It keeps going down, it descends. It goes in a descending order, chronologically, okay? So we do not have to read, just get acquainted with the topic of phobia pills, and then we just read the first question. There are 4 options, you must be noticing. In B, we have 3 choices. Here we have 4 choices. So 7th, in the first paragraph, the writer says that conventional management of phobias can be problematic because. It's good to translate it and understand it. So if you do not know the meaning of conventional, your question sorted it. So Srijana, what is the meaning of conventional? वर्ड थाहा भएन भने यसलाई छोड्दिने या कुनै गेस गरिदिएर अर्कोतिर मुभ गर्दा हुन्छ if you do not know the word, because you have to understand the question. First paragraph, in the first paragraph, पहिलो प्याराग्राफमा राइटरले भन्नुहुन्छ कन्भेन्सनल म्यानेजमेन्ट जुन हुन्छ फोबियाको त्यो किन प्रब्लमेटिक हुन्छ? ए किनभने त्यो ट्रिटमेन्टको साइकोलोजिकल इफेक्ट पछिसम्म रहिरहन्छ। बी कज अफ फोबिया आइडेन्टिफाई गर्न टाइम लाग्छ। सी लिमिटेड थेरापी र प्रोफेसनल भएको हुनाले। डी एउटै फोबियालाई धेरैचोटि कन्फ्रन्ट गर्नुपर्छ। नाउ इफ यु डोन्ट नो द मिनिङ अफ कन्फ्रन्ट देन अगेन यु आर इन प्रब्लम। सो आई एम नट ट्रान्सलेटिङ इट, लेट्स ट्राई टु गेस। हामीले हेरौँ यो। दिस इज द फर्स्ट प्याराग्राफ चेक। आई विल गिभ यु 1 minute 15 seconds। हेर्नु त एकचोटि यसलाई। That's 1 minute and 15 seconds. अब हेर्नु त एन्सर। Answer? यस्तै हुन्छ रिडिङमा। Like it's always tricky. It's not so predictable as writing and speaking. You need to know the vocab, you need to know the words. त्यही पनि guess गर्नु, what is the answer? 7. And I'll explain you what they are intending to say.
B.
You didn't understand the question. Conventional भनेको पुरानो म्यानेजमेन्ट जुन हुन्छ फोबियाको, पुरानो ट्रेडिसनल म्यानेजमेन्ट हुन्छ फोबियाको किन कम्प्लिकेटेड छ भनेर सोधिरहेको छ। दे आर आस्किङ दिस हियर। अब बी होइन, यसको सी हो कि एउटै फोबियालाई धेरैचोटि रिपिट, जस्तै ककरोचसँग इफ यु आर स्केयर्ड अफ ककरोच एन्ड यु वान्ट टु ट्रिट इट इन अ कन्भेन्सनल वे, then you need to keep seeing the cockroach every day so that your fear and anxiety reduces. That's what it means. This is problematic way. Conventional manner. Second paragraph ma dark side भनिरहेको छ। के हो मिनिङ हो यसको dark side को? What's the meaning of dark side? हैन? Memories of agreeable events tend to be inaccurate. Agree गरिरहेको मोमेन्टहरु, मेमोरिजहरु inaccurate हुन सक्छ। पोजिटिभ मेमोरिजहरु समयसँग नेगेटिभ हुँदै जान्छ। अनह्याप्पी मेमोरिजहरु ह्याप्पी मेमोरिज भन्दा मोर डिटेल हुन्छ। अनि अनप्लेजेन्ट मेमोरिजहरु चाहिँ सर्टेन प्रम्प्टको रिस्पोन्सले फेरि अराउज हुन्छ। अराउजको मिनिङ थाहा हुनु पर्यो, प्रम्प्टको मिनिङ थाहा हुनु पर्यो त्यसको लागि। डार्क साइड Check. What's the meaning of dark side? All right. Dark side भनेको meaning के हो? The writer uses the phrase dark side. के idea reinforce गर्न खोजिरहेको?
A,
Agree गरिरहेको इभेन्टहरूको मेमोरिज इनएक्युरेट हुन्छ भनेर कहाँ छ दिएको त्यस? नो. अरू गेस गर्नुलाई हेर. यसमा के भन्दैछ भन्दाखेरि ककरोचसँग डर
B,
लाग्छ रे. इफ यु स्केयर्ड अफ अ सर्टेन इन्सेक्ट फर इक्जाम्पल, मैले इक्जाम्पल दिन खोजिरहेको छु भनेपछि कतै फ्युचरमा स्पाइडर देख्यो भने पनि डर लाग्ने भयो भनेर भन्दैछ कि. सो एउटा ककरोचको डरले स्पाइडरसँग पनि डर लाग्छ भन्दैछ कि. सो सानैदेखि ककरोचसँग डर लाग्छ भनेपछि अहिले त्यस्तै खालको केही इन्सेक्टहरू देख्यो भने फेरि त्यो जुन पहिलेदेखिको जुन फियर छ, फियर द्याट यु हेभ, द्याट अराउजेस I mean recent fear to another insect. D answer हो नि. Unpleasant memories are aroused in response to
D.
certain prompts. Certain prompt भनेको अहिले किडा देख्यो भने पुरानो भएको मेमोरीबाट फेरि डर लाग्छ भनेर भन्दैछ. 8. In the second paragraph, त्यही प्याराग्राफकै हो फेरि हेर्नु. In the second paragraph, extinction learning is explained as a process with. Extinction learning भनेको के हो भनेर सोधिरहेछ. त्यही second paragraphकै हो. You can take a bit longer. I'll give you a minute. The dark side? के dark side you mean?
B,
हजुर?
B,
नाइ ए सर डार्क साइड त भइहाल्यो होइन सरी एक्सटिङ्सन प्रोसेस सरी एक्सटिङ्सन प्रोसेस भनेको कुन चाहिँ होइन एक्सटिङ्सन भनेको के हो हराउँदै जानु होइन एक्सटिङ्सन प्रोसेस चाहिँ कसरी हुन्छ भनेर सोधिरहेको छ कि सेकेन्ड प्याराग्राफले भन्दैछ ए एन्सर हो नि ब्रेनको जुन इन्नेट फङ्सन हुन्छ नि त्यसलाई एक्सप्लोइट गरेर एक्सटेन्सन लर्निङलाई हामीले अगाडि बढाउने हो D को they're not talking about D, they're not talking about C, they're not talking about B. There's only one option. B, C, D सबै wrong छ A मात्रै correct त्यसमा For that same reason भनेको के हो What is the meaning of for that same reason? पेशेन्टहरूले थेरापीको बेला फिल गर्ने एङ्जाइटी पेशेन्टहरूले अनसपोर्ट फिल गर्ने न्युरोसाइन्टिस्टको एथिकल कन्सर्न एथिक्ससँग रिलेटेड कन्सर्न अनि साइकोथेरापिस्ट जसले चाहिँ अनसुटेबल पेसेन्ट्सहरूलाई लिन्छ small paragraph very small paragraph see 1 minute ल For that same reason भनेको के हो
C,
correct In the fourth paragraph, we learned that the drug called DOS हो खासमा टाइपिङ एरर छ त्यहाँ यो DOS भन्ने औषधिले के गर्छ यो DOS अनसेफ छ एक्सेप्ट सानो क्वान्टिटीमा युज गर्यो भने सर्टेन टाइपको फोबियालाई मात्रै कन्ट्रोल गर्छ यसले न्युरोनलाई अफेक्ट गर्छ अनि यसले चाहिँ सर्टेन इभेन्टको इमोसनल इम्प्याक्ट बढाउँछ DOS भन्ने मेडिकेसन हो यहाँ चाहिँ यो प्याराग्राफ हो one such avenue check Answer? यो DOS के अरे सरी यो DOS भन्ने औषधिले के गर्छ?
C.
Maybe yes, correct. In the fifth paragraph, some critics believe that one drawback of using DCS is. पाँचौं प्याराग्राफमा कुनै कुनै क्रिटिक्सले बिलिभ गर्छन् कि DCS को ड्रब्याक के हुन सक्छ, DCS अनि DOS को ड्रब्याक के हुन्छ, ड्रब्याक भनेको के हो मिनिङ, यु निड टु नो द मिनिङ अफ द्याट, मिनिङ थाहा भएन भने बिग्रियो। ए, त्यसको बेनिफिटहरु एउटा सर्टेन समयसम्म मात्र हुन्छ, इट इज ओन्ली हेल्पफुल फर सर्टेन टाइप्स अफ पर्सनालिटी, कुनै कुनै टाइपको पर्सनालिटीको लागि मात्र हुन्छ, एकदम थोरै पेशेन्ट्सले मात्र के अरे ट्रिटमेन्टको कोर्स सकाउन सक्छ, पेशेन्टहरु चाहिँ ल्याक अफ प्रोग्रेसले गर्दाखेरि डिस्करेज हुन्छन्। फिफ्थ प्याराग्राफ हैन, चेक यो सानो प्याराग्राफ फर पिपल वाला प्याराग्राफ, टेक 1 minute 15 seconds. के हो ड्रब्याक? ड्रब्याक भनेको नराम्रो पक्ष, ब्याड पार्ट, कमजोरी।
B.
ए हो, जबसम्म औषधि खायो तबसम्म ठिक छ हैन, औषधिको त्यो हुन्छ नि इफेक्ट सिज हुने बित्तिकै फेरि डर लाग्न थाल्छ। It's limited. Its benefits are likely to be of limited duration. In the final paragraph, दुईटा question every paragraph को, final paragraph को. So we have 2 minutes for 13 and 2 minutes for 14. So 2 to 4 minute भन्दा हामीसँग. So हामीले यो 4 minutes मजाले use गर्न मिल्छ if there are 2 questions coming from the same paragraph. In the final paragraph, we learned that Kent's study into anxiety disorders focused on how किन्स भन्ने मान्छेको जुन स्टडी छ एङ्जाइटी डिसअर्डरमाथि, त्यो चाहिँ केमा फोकस छ, केसमाथि फोकस छ? होइन सरी, केमाथि फोकस छ कि प्रोटिनले मेमोरीलाई रिट्रिभ गर्छ, रिट्रिभको मिनिङ थाहा भएन भने मिल्दैन यो फेरि। मेमोरिजहरू एक अर्काको माथि सुपर इम्पोज हुन्छन्। नेगेटिभ मेमोरीहरू चाहिँ को फ्रिक्वेन्सी घट्दै जान्छ। जुन मेमोरीले गर्दा कुरा जुन इमोसनल फोर्स हुन्छ त्यो चाहिँ नेचुरली राखिरहेको हुन्छ, नेचुरली रिटेन गरेको हुन्छ। या त्यो पढौँ अनि त्यसपछि 14 मा चाहिँ प्रोप्यानोलोलले के गर्छ भनेर सोधिरहेको छ। चेक एउटै प्याराग्राफबाट हो, यु क्यान टेक 2 मिनट्स फर दिस अनि 2 मिनट्समा चाहिँ बाँकी दुईवटा क्वेसन चाहिँ ट्राई गरौँ। अलराइट, चेक केमा फोकस छ किन्सको स्टडी?
D.
मेबी डी 14 को भेरी लाइकली डी जस्तो छ। हो
A.
होइन, प्रोप्यानोलले के गर्छ?
C.
होइन ए पनि एकदम इजी छ नि यो त इन्क्रिज पेसेन्स टलरेन्स अफ की ट्रिगर्स कतिजना स्टुडेन्ट्सहरूले ओइटीको एक्जाम दिन पनि यो प्रोपानोलोल खाएर जान्छ यसले हार्ट रेटहरू घटाइदिन्छ मजाले So we have another one here, challenging medical thinking on placebo. This is going to be a homework, Sujana, and all the writings and everything that is there. Sabai boli ekachoti check huncha hai. So check this. Actually, फेरि review गर्नु कुन किन गल्ती भएन. If you have any questions, you can ask me tomorrow. Yeah, this is the homework for everybody, and whoever is not present also, they're also going to have the same homework. Okay, we'll talk soon.